Blood pressure is a dynamic parameter. It's not any magic number that you can measure just once. So, by definition, the longer we keep monitoring, the more precise is our estimate, and then the more accurate is a diagnostic evaluation. Well, we can measure blood pressure with different methods. If you consider, for example, the office readings, definitely we should avoid quick spot measurements. The guidelines are very clear in this regard. They recommend repeated measures during a given visit and repeated visits before taking any conclusion. So even with office pressure, we need to measure blood pressure repeatedly over time. Considering home blood pressure, the indication we're already giving is that we should ideally have 1 week of measurements, twice in the morning, twice in the evening, before each physician's visit. If 7 days is difficult, at least not less than 3 days. But again, longer time might be useful because you get more information. And finally, if you consider the classic ambulatory blood pressure monitoring, we are already asking for 24 hours, and definitely we should have 24 hours, not shorter time periods. It's very important to include the day and the night because we get different information. Hypertensive patients, when we have already a diagnosis, of course we need to repeatedly check the blood pressure. How frequently? Well, this depends on the severity of hypertension, on the severity of the cardiovascular risk level. In mild hypertension, low cardiovascular risk, maybe once, twice a year, could be enough just to keep things under control. But of course, if you have an increased risk, you need to do it much more frequently, depending on the need you have to get information to optimize blood pressure control. As I said, blood pressure is a dynamic parameter, so there is no ideal time of the day. What we try to do is to standardize the time, at least to be able to compare data, because obviously blood pressure can be different in the morning, in the evening, after a meal, when you wake up, when you go to bed. So if you want to compare data among different people, it would be nice to have comparable situations. So what we are recommending, of course, in the office, is to have the blood pressure measurement after 5-minute rest when you are seated, and then you take the 3 measurements. At home, we recommend to have a blood pressure measurement in the morning, before taking your pills, before having a meal, the same in the evening, before dinner, so you have data comparable. Of course, you might wish to have additional measurement in specific time of the day, and then the selection of the timing depends on the information you want to get. And this is to be personalized depending on the individual needs. Recently, well, we've been facing continuous flow of evidence, new recommendation coming. Very recently, before this conference, we published some recommendation from the European Society of Hypertension on home blood pressure measurement, on the blood pressure measurement to be taken in a clinical setting, and there we gave a lot of detailed information. Now there is another paper coming on blood pressure variability, which is also important because it's the phenomenon behind our measurements. In this specific conference, there are other guidelines coming related to arrhythmias or to pulmonary hypertension, and indeed there is a lot of new evidence coming also here. But what is going to be discussed mostly here is the need of prevention to prevent appearance of diseases, and the importance of diagnostics, in particular imaging, which is one of the key issues in this Congress. I might better tell it at the end of the Congress, but
okay.
Definitely there is a lot of focus on imaging. That was one of the main topics selected for this Congress. Although there is a lot of information also on blood pressure measurement, on any kind of technological support, including digital health, that might help us diagnosing something earlier and preventing the appearance of serious complications.